Discuss about the gluteal region. In the gluteal region, we are saying the most important muscle is the gluteus maximus muscle. So whether we are removing the skin superficial fascia and the deep fascia, we will see that one the big muscle is called gluteus maximus muscle. So this is the gluteus maximus muscle. You are seeing the gluteus maximus muscle. So what is the origin insertion for this muscle? It's a very important muscle because this muscle is mainly responsible for extension of hip joint. So sitting to standing position, if the person wants to come, we are using this gluteus maximus muscle only. This gluteus maximus is a principal extensor of hip joint. This muscle origin from where? This muscle take originating from the ilium, sacrum, coccyx, as well as one ligament is extending from the sacral bone to the ischial tuberosity. It's called the sacrotuberous ligament. Sacrotuberous ligament. These are all the points for the origin of this gluteus maximus muscle. If we want a clear picture about the origin, this line is called posterior gluteal line. The area behind the posterior gluteal line on the ilium, that will give the origin for this gluteus maximus muscle. This is the dorsal surface of sacrum and the dorsal surface of coccygeal bone. The next one ligament already I mentioned, one is the sacrum to the ischial tuberosity, is called sacrotuberous ligament. That will also give the origin for this muscle, gluteus maximus. So this muscle get inserted into 2 points. One is the iliotibial tract. How will you identify this iliotibial tract? This is the iliotibial tract. Are you seeing iliotibial tract here? It's very clear. It's very clear for this iliotibial tract. You just see this is the gluteus maximus muscle. This muscle, the 3/4 of fibers, the most of the fibers where get inserted means it get inserted into the iliotibial tract only. What is the importance of this iliotibial tract means it's connecting the ilium to the tibial bone. This iliotibial tract attachment supporting the knee joint indirectly. So the gluteus muscle stabilizing the knee joint through which structure means through the iliotibial tract. That is one of the important point for this gluteus maximus muscle. The 1/4 of the fiber is get inserted into the femur. In which part of the femur? That is very important. The 1/4 of the fiber get inserted into this rough area is called gluteal tuberosity. The gluteal tuberosity is giving the insertion of gluteus maximus muscle in the cadaver. It's very clearly you are seeing the insertion point for the 1/4 fibers into the gluteal tuberosity. You just touch and feel. Here you have to touch and feel. Stop. This muscle is supplied by which nerve? I am seeing here one nerve. It's called a inferior gluteal nerve. Inferior gluteal nerve. This inferior gluteal nerve, how will you identify the inferior gluteal nerve? I am seeing the first one muscle is called piriformis muscle. Just below the piriformis muscle I am seeing that nerve. That nerve supplying the gluteus maximus. So that nerve is called inferior gluteal nerve supplying the gluteus maximus muscle. Is supplying only one muscle only. That is the gluteus maximus. Already we know the action of this muscle. That's the gluteus maximus muscle. What is the action for? Is the extension of hip joint. Extension of hip joint. That is the principal action. What are the other action is done by this gluteus maximus? Is responsible for the abduction of hip joint, lateral rotation of hip joint, as well as is responsible for the adduction of hip joint also. So these are all the action is done by this gluteus maximus muscle. That's why we are giving more preference to this muscle.